talk to you about Biomics, which is a company based in Uppsala that develops antibiotics for novel targets. I'm Oliver, she's Sarah, and here's Peter. But before talking about the subject, I will talk you more about what antibiotic resistance is, how it's spreading, and what we can do to fight it. So, a study published in 2014 from the World Health Organization affirmed that by 2050, around 10 million people will die every year because of antimicrobial resistance infections. And this is a huge number when compared to the 700,000 people who died in 2014 because of this reason. And 10 million deaths would also be higher than the death rate caused by cancer. So this problem would be even higher than cancer, which people currently think it's the worst thing in the world. And when looking at the economical aspect of this, it would cause, it's expected to cause an economic loss of around $100 trillion per year. And to give you a better insight in how much money that is, I want to show you this picture. This is $1 trillion in $100 bills. So imagine, imagine 100 times this. That's how much we would lose every year because of antimicrobial resistance. So how's this happening? Well, there are two main reasons for antimicrobial resistance developing. The first one is that resistance is a natural phenomena. Bacteria that produce antibiotics have resistance genes for those antibiotics, and they can spread it to other bacteria, and they can develop resistance to any antibiotic through mutation. And secondly, another very important reason for antibiotic resistance is that in the last 30 years, no new class of antibiotics has been discovered. This is really important because bacteria can develop resistance to antibiotics of the same class faster than to antibiotics of a different class. So in the last 30 years, bacteria had all the time in the world to keep on developing resistance for all the new antibiotics because of they are in the same class as the previous ones. So currently, all antibiotics target mainly three components: either the cell wall or cell membrane, the nucleic acid synthesis, or the protein synthesis. These are the three categories, and in each category there can be seen different targets, and we have an example for each specific target. And on the last column you can see a list of the bacteria that are currently critical for the resistance phenomena, because these bacteria are currently developing resistance for the last resort antibiotics. And once the majority of them manages to do this, there will be currently no cure to treat the illnesses caused by these bacteria. So what can we do about it? Well, obviously the main approach is obviously drug design, drug discovery. And a study affirmed that around 10 to the 100th possible drug-like molecules exist, or could exist. And well, this is a huge number. We can't really expect to discover all these molecules. Our best chances to discover as many as possible is drug discovery through either hit generation or de novo design. Now, hit generation is a more stochastical approach in which a selected target is either compared to a library of pre-existing ligands, either in chemical experiments or through computational experiments. Or otherwise, it's possible to use some softwares that try to find the best ligand for a target, and then casually modify it to try to better fit it inside a certain site. And while the advantages of this technique are that it's easy and doesn't require a deep knowledge about the target, but the disadvantages are that it requires a lot of time, and in case we are using the software system, it requires a high computational power. It's possible to make it quicker by adding, if we're using softwares, by adding more information about our target, like for example, chemical physical properties about our target. But at that point, the no need for deep knowledge is not an advantage anymore, because we will need the information about our target to feed to the software. The second approach is de novo drug design. In de novo drug design, we can select any target at will and any site at will. And by knowing the chemical properties and physical properties of a specific site, we can design a drug to interact specifically with this site to obtain a desired effect. And the advantages of this technique are that they have a higher rate of production of an active drug when compared to the hit generation techniques, and also the possibility to choose any target and site as well. But the disadvantages are that it requires a very deep knowledge, both about the target and also by part of the researchers trying to develop this. So how does this connect to Biomics? Well, Biomics, as I said, is a company based here in Uppsala, and they're trying to develop antibiotics to target RNA-sp, and they're trying to do this through de novo design drugs. And Vidur will talk us more about RNA-sp as a target.
So, why did we choose RNA-sp? It's just because we want to kill the bacteria using a new method. So, RNA-sp here is an important molecule which is present in each and every single cell of all the kingdoms of organisms. So, this molecule helps in the maturation of tRNA. Here, we have shown that. So, the pre-tRNA is being matured. So, if we block this if we block this in a molecule, the whole process of maturation will be blocked, and hence the translation will be stopped and the cell will die. So RNA-sp, it mainly consists of two subunits. The third subunit here is because we have the premature tRNA as well, which is actually attached to the RNA-sp. So we have mentioned the colors. This is the main two subunits are almost common in all the organisms, but the clear differences are seen in the amount of each molecule present. So, for example, the protein subunit there in eukaryotes it's 10 subunits, while in prokaryotes it's just 9 or 8. So here, when they visualized it, it was found that the active site of the enzyme was the helix P4, and which is actually present there where the actual reaction happens. So this region which is marked in red, it is so concentrated with metal ions. One of the most common metal ions here is magnesium ions. So the interactions here are mainly classified into two, which are non-specific and specific. So the non-specific metal ions are mainly placed in the negative potential regions, so that they are just for like stabilizing the interactions between the molecule between tRNA and RNA-sp. While the specific specific interactions acts as cofactors, and also they help in catalyzing. Apart from the metal ions, proteins also helps in catalyzing, and they form good interactions between the RNA-sp and tRNA. So the chemical aspect of these metal ions are the ionic radius have an immense effect on the interaction, because compared to when you compare two metal ions, let's say magnesium and barium. Magnesium has a a smaller ionic radius. So a lesser ionic radius means polarizability of the ion is more. So the charge will be more, and it will pull the tRNA towards it. So yeah, here in Biomics, what they actually do is they replace these metal ions using aminoglycosides. Aminoglycosides are also positively charged compounds. So when you move the metal ions, the whole RNA-sp structure disrupts, and whole RNA-sp structure disrupts, and the activity of the RNA-sp is blocked. So other ways of inhibiting RNA-sp other than what we do in Biomics are peptidyl transferases. They actually mimic the 3' end of the amino acyl tRNA, which is of less importance. And apart from the aminoglycosides, which actually moves the metal ions, they also inhibit by changing the pH. So since RNA-sp is an enzyme, so when the surrounding pH changes, the enzyme activity is inhibited. Antisense inhibition is one of the important method of inhibition, but it also has some side effects, disadvantages. So the main target here is P15 loop, And so we use we use enzymes, and we use DNA and RNA, which actually forms hybrid to the P15 loop target. So if we form hybrid, the hybrid won't allow the tRNA to attach to the P15 loop. But these hybrids are basically nucleic acids. So these nucleic acids are prone to degradation by the enzymes. So third generation antisense agents such as LNA and PNA were discovered. LNA and PNA are like they are synthetically found nucleic acids, which is locked nucleic acid and peptide nucleic acid. So these forms they also form oligomers, and they are not degraded by the enzymes. So they form oligomers to the P15 loop, and because of this, the tRNA could not be anchored to the hybrid P15 loop, and thereby they disrupt the whole mechanism. So now we have talked about the scientific aspect of our company. So we move on to the business aspect, which will be explained by Sarah. Yeah.
Okay. So when starting a company like Biomics, is of course important to have a good idea and valid scientifics to back it up. But it is equally important to have a good business model in order to succeed with a company like Biomics. A business model is basically how a company makes profit of its provided service or product. And as we all know, the pharmaceutical industry have been forced to downsize a lot the last couple of years, and therefore the business model needs to be very suitable for today's market in order for these businesses to survive. And Biomics have different approaches for their business. And the first one is that they do the research, and if they succeed, develops the product, and then they will either be selling the product by themselves or in collaboration with another company, which is more likely. Another idea that they have is that they develop the product, and hopefully it is that good that a larger pharmaceutical company will buy Biomics, and this is called an exit. So business strategies is of course very important as well. And outsourcing, which you may have heard of, is increasing in the pharmaceutical and biotechnological industry very rapidly. And usually they outsource to contract research organizations or contract manufacturing organizations. And outsourcing is basically when a company hires another company to do a task that is usually made in-house in the company. And this has been proven to be very cheap and an effective alternative instead of doing it by themselves. And you may have noticed some outsourcing in regular industries today. A very common one is cleaning of facilities in schools and hospitals and industries like that. And therefore this is increasing, and they use it a lot in pharmaceutical industry, as said. And the Biomics is basically outsourcing all of their R&D to companies spread around the world. So they have been collaborating with companies, a different number of companies during the years, but right now they have 3 companies that they are collaborating with, and seen in this figure, it is Jubilant, Laxai, and Eurofins. And Jubilant performs biological characterization of the molecules that they produce, and it's located in India. Laxai, as well located in India, performs chemical synthesis, and Eurofins, which is located in Taiwan, performs the animal testing of the molecules. And by doing this, Biomics is able to save the money that they would have invested in expensive facilities or expensive employees and training of the employees, and can focus on the research and the production instead. So to conclude the work we have been doing, we can say that antibiotic resistance is a threat that is very, a very major threat to human health. And we need to develop new antibiotics. And mostly to this priority pathogens that Oliver mentioned in the beginning, because these can really harm us in the future. But the market for companies to do research about antibiotics is not that attractive because it has low profit probability. So they won't earn money from this most likely. So there's not a lot of research going on, and there's not a lot of companies that work with this. And therefore we need companies like Biomics that use a very other approach and focus on developing synthetic antibiotics that target RNAsP or similar targets that are novel. And also business models that are adapted to the market that we have today, and using outsourcing that is increasingly proven to be very efficient. So thank you for your attention.
Yes, thank you for this presentation on biomics, and the talk is open for questions.
I have two questions about this contract with research organizations.
Mm-hmm.
What are the deliverables inside the contract with research? It's like you really don't know where research will end up.
Yeah, sure.
Well, in this case, let's say they have a potential target and they just tell them the risk of it. Saying it as this math molecule and the other results. And then the result analysis is really, like, it's predefined for how many animals you tested on, how many it's in the project design. We don't define the outcome, but more like, let's say, the process setting. Whatever it comes out of it, you can't predict that.
Okay, so they don't define the outcome, but do you think there's a danger of result-oriented research? Like that they produce the results that the other contractor wants to have instead of
Like the contractor is biased, or
yeah.
Yeah, that is of course a risk. So when you choose the companies, you have to do the Biomics have to do the research and look at the credentials of these companies. And since the outsourcing is increasing, contract research organizations are of course also increasing, and this leads to a higher availability to such documents and credentials. And so I think it's
The bacteria that we have listed in Italy, what are the predictions when is that going to work?
Okay, the red ones is highly critical, yellow ones are medium critical, and green ones are
I can
low critical, but
what does highly critical mean in the next happening?
yeah, like highly critical is basically happening. Like they are right now, yeah.
Right now.
Yeah. Like
So
these ones, I think many are already, like most of them is already quite resistant to bacteria, to antibiotics.
For the ones like enterobacteria, that's the stuff like cholera, right? Isn't it? Am I right?
Yeah, but
Or that's the thing is, it's happening as in they have found one source somewhere on the globe that's different.
yeah, exactly. Like somewhere at least this has already happened. And also for enterobacteria, it's like they are the most critical ones, probably because they are the ones that get the highest dose of antibiotics when someone takes some.
It's not completely global. But, so, yeah, exactly. It's not that it happens once for it to be different.
You said that
It would completely block the translation
Translation
because it's involved in the maturation of every tRNA. So if RNA-sp is blocked, then there will be no mature tRNA and translation will be completely blocked.
So human transgenes is basically.
Oh no, because the advantage of RNA-sp is that drugs can be developed against it, and they can be even specific for a bacterial species. Like it would be possible to target two different bacteria with two different drugs and not affect each other.
So there will be multiple kinds of drugs targeting multiple kinds of organisms. So it will
It's
not be
possible.
a
It's
broad spectrum, but it will be very
if I understood it correctly, it should be possible to do like one bacteria, like one drug that targets maybe like gram-negative or a specific, like a general bacteria, or if we want, we can do it specific for a species.
So how do we differentiate between a gram-negative and a gram-positive bacteria using the ribonucleic acid?
The protein part changes.
Yeah.
That's highly that changes highly between
the
species.
amount between all the species differs. So that's why I said that, for example, like for eukaryotes, if it's around the protein subunits is around 10, for your prokaryotes it changes to 8 or something. Yeah. But probably in all the organisms, the main active portion is conserved, but there is just a slight difference which can easily change between humans RNA-sp and a bacterial RNA-sp. So if we can easily target bacterial RNA-sp instead of targeting human RNA-sp.
Now, can you explain again how aminoglycosides affect the specificity of RNA-seq?
Yeah, I mean, these are also positively charged molecules. So what they actually do is metal mimic. The process is called as metal mimic. So instead of magnesium ions, they push out the magnesium ions, and instead of that, these compounds go in that side. So if this compound, the interaction, like in most of the compounds, the tertiary structure happens due to metal interactions, right? Metal ions are like hydrophobic interactions which cause the rigidity of the whole molecule. So if the metal ions is removed, the rigidity is disrupted. So hence the activity will also be like changed. The RNA-sp won't be active anymore.